Good morning, Brian and Henry. Appreciate your time out of your hectic schedule today to meet with me. My name is Sandro Stefanelli. I'm a software client leader with IBM, and I support the healthcare market space. Today's discussion is going to focus on the value of analytics, enterprise analytics specifically in healthcare, and how it's helping lead the transformation in the new market space. I've prepared a few slides to guide our discussion and outline a brief agenda. Focus on the challenges and the market trends that healthcare providers are facing today. Talk about, as IBM works with hundreds of customers in the healthcare market space, what are some of the strategies for transformation in the healthcare provider market space that we're seeing? What is the value of the big data from a business perspective? But also, as we work with these customers, what are some of the basic common threads of challenges as they begin their enterprise analytics journey? Touch upon IBM's integrated smarter care portfolio solutions, followed by 2 case studies, and take some questions. And then we can discuss appropriate next steps. So, as you know, there's many factors driving the transformation in the marketplace for healthcare providers specifically. One of the key areas that I think is having a significant impact is a change in the consumer behavior as they utilize and shop for their healthcare services. As more consumers are responsible for a greater portion of the cost of their healthcare, they're placing greater demands on the healthcare organizations to be more transparent with their information, whether that's for patient outcome, quality of care, as well as transparency to cost. But also, because of the increased competition amongst healthcare networks, consumers have more choices available to them that they did not have in the past. So again, they're putting greater demands for their business spend with the organizations in the marketplace. But most importantly, the increased regulatory requirements is really driving, really impacting the reimbursement model for healthcare. And in many cases in a negative way or downward pressure, whether that's reimbursements for Medicare or for readmissions within 30 days for certain disease states. But also, we're seeing a great leverage of data, a large volume of data being captured in healthcare providers at the bedside with health monitors, but also a lot of focus around gene sequencing to be able to provide personalized medicine. This is an area that's leveraging large volumes of data, and if harnessed properly, can provide tremendous business value that's not being realized today. So, in a nutshell, providers are being asked to do more with less, provide better outcomes, better quality of care in a market environment where there's less financial resources to be able to do so. So organizations are seeing the value of leveraging enterprise data as being essential to survive in this new landscape. So what are some of the strategies we're seeing in the marketplace as organizations try to deal with this shift in dynamics? Mergers and acquisitions. As there's financial pressures, as there's downward revenue pressures in the reimbursement model, there's a lot of pressure to grow to economies of scale and grow your geographic footprint. As we've seen here, just with Jefferson within the last 2 weeks, you folks have announced a merger with Abington Healthcare. That's a prime example. And I would not be surprised to see Dr. Glasgow announce additional alliances and mergers in the future as well. So in addition, organizations are implementing, healthcare providers specifically are implementing EHR systems. This allows them to meet meaningful use guidelines, which is critical from a reimbursement level as well. And again, this is something that TJU has recently acted upon as they've announced the decision to implement Epic over the next couple of years. And the third area, which is sort of the focus of our discussion, is implementing an enterprise data analytics and big data strategy to thrive in this new marketplace. And with the goals is to improve patient outcomes, reduce readmissions, and improve operational efficiency. So it has clinical benefits, but also business and operational benefits as well. So big data can impact every aspect of an organization, not just clinical, not just operational, not just financial. So this slide just tries to highlight that aspect of things. Just want to focus on one key area here, because we talked about the consumer and how critical the consumer is. So knowing your consumer, knowing your customer is more critical than it ever was before. And that not only relates to providing the proper care and the best quality care that you can provide, by knowing that customer and their situation, but also to be able to tailor your communications and education and maintain a relationship with that customer for today and going forward in the future. But big data can be used in all sorts of ways, whether that's to identify fraud, risk, whether that's to capture streaming data at the bedside and monitor assets and monitor devices, or just monitor medical equipment and maintenance cycles and things of that sort as well. So as we work with these hundreds of organizations across North America, and with organizations that are at the foundational level of their enterprise data strategy, we see some very specific common challenges across organizations. First off, data exists throughout an organization in disparate systems, whether that's clinical, financial, operational systems. They're typically siloed, they're not integrated, there's no enterprise view into this data. And as a result, reports and queries are usually run off one, maybe two systems. So the quality of that data and the trust in that data by the line of business using that data is not very high, and as a result, the maximum business value is not being realized. Another key area here is the ability to leverage unstructured data. 80% of clinical data today is unstructured data, mostly in the form of physician notes. Most organizations do not have the ability to capture or leverage that unstructured data to its maximum value. So going forward, the ability to capture and utilize that data to improve outcomes, being that it's 80%, is significant. And then organizations see the need as they evolve through the maturity cycle to have a predictive analytics strategy as well. So here, just a brief slide, just to outline, just want to highlight to you the breadth of capabilities that IBM has around their Smarter Care portfolio. A fully integrated set of solutions here that can be delivered by IBM's global services, subject matter expertise in the healthcare market space. We've broken this out into a few different layers here, and based on my discussions and interactions with Thomas Jefferson over the past year, my understanding is your focus here is really on the foundational level to fill in some of the gaps. You do have some of these capabilities currently in place, one being the EMPI solution that you purchased from IBM, the IBM Initiate solution for master data management, which has been in place for about the last 2 years. But we look forward to working and developing a strategy with Thomas Jefferson to fill in the gaps and align with your strategy. But the key point here, as you evolve and grow your use cases and grow the business need into different areas, IBM has capabilities that can build off the foundational tools that you set in place today to expand the value throughout the cycle. So we have two use cases here to end with. We have Premier Health Alliance, an alliance over 2,200 hospitals. They're in a unique position that they're able to capture data from their network alliance members and really do peer-to-peer evaluations. So they were trying to improve patient outcomes by enhancing the data and providing analytics. So in this specific use case, it's about a population of around 300 plus hospitals who leverage this in a way, leverage the analytics in a way to save over $2.8 billion in healthcare spend and save over 23,000 lives. So again, a case of not only financial benefits, but improved patient outcomes, obviously, as well. So this is a prime example and a very great demonstration of the capabilities of how IBM can partner. And then we have UCLA Health System. They rely on our big data technology to capture and analyze streaming data at the bedside within the intensive care unit. In this particular use case, they're specifically focused on patients with traumatic brain injuries. So by analyzing that streaming data, they're able to predict critical changes in the patient's condition so they can put the appropriate care plan in place. So I appreciate your time today. I hope you found the time beneficial. I'll open up to any questions and look forward to working with Thomas Jefferson going forward.